I like that the talk is called Understanding Ketamine, because ketamine is a molecule that it's probably my favorite to work with, and I don't understand it at all. Every time it feels like something different is happening. I just would love to hear from experts around what you think it does for people.
Sorry, Adam.
Well, that's the understanding.
The talk is done. Yep. So thanks so much. Just a little bit of our background of Riverbird. Colin mentioned that we started forming together in 2018. We officially formed in 2019, but when we formed in 2018, we actually came together as a group of therapists, physicians who were interested in MDMA therapy. And Max was working on a side trial away from the phase 3 clinical trials, but it was MDMA therapy for post-traumatic stress disorder. And there was this sort of side trial that they were doing in a few locations, and we came together as a group interested in that modality. And that's why there's sort of a nod to sassafras in the picture. There are 2 paintings in here by Martin Bridge, who has his artwork up on the other side of the campus. But MDA, which is related to MDMA, it can be synthesized from sassafras. It's a really complicated process. Please don't go out and buy sassafras and think that you're going to have an experience like that. So we officially formed as a clinic in 2019, and we knew that the research game is a long game, and it was going to be quite some time before anything happened where we could open our doors and have accessibility to multiple people. And ketamine was emerging or re-emerging, not just as a pharmaceutical that could be used in anesthetic purposes, but also there was all this research in terms of depression that we could talk around just as an infusion, as a pharmaceutical there too. But also this sort of side trail of ketamine-assisted psychotherapy or ketamine-assisted psychedelic therapy, which had sort of been really in the margins, off to the side for quite some time. So we knew that we could use ketamine in an off-label way in a psychedelic model and make it accessible to hear folks' local importance. And the piece that we just held together through all of this is being integrative medicine providers, psychiatric nurse practitioners, psychotherapists. We were all holding this holistic view of humanity suffering and thriving, and this balance that people are with. And we started offering ketamine-assisted therapy in a medical model. That's what we were operating within, but also trying to be creative of how do we expand that. But we started with some of the nuts and bolts, and because we were sort of the new act in town, we were staying in our sort of trying to be in our boundaries. And so we were trying to address diagnoses such as depression, anxiety, post-traumatic stress. And as we got our comfort and skills going and also acknowledging what's happening in psychedelic medicine in general, we were engaging in this discussion around psychospiritual growth. And so we can talk a little bit more about that in a moment. But these are some of the folks who have been on our team. It's a lot of credentials, and that's just how we were trying to have ourselves operate within a legal framework. And sadly, we still can't take insurance because ketamine there's a different formulation of ketamine called Spravato that can be covered by insurance. Some people might have heard about that, but there's a specific training that you do, and they don't necessarily use it in a psychedelic model. So we just we did our best to cover ourselves legally and also acknowledge that we're coming from a background where we're all white, we all have graduate degrees, we're all pretty cisgendered and heteronormative. And so we were just with those components as well while we were getting ourselves up and running in Portland. The next one. So where we are housed is the Good Medicine Collective. Good Medicine Collective is on other side of town. It's a wonderful space. It's gone through a few iterations of its existence. I'll say what it is now is that it's a mission-driven co-working space. And in this mission-driven co-working space, we can have business entities like Riverbird, other therapists, acupuncture, massage therapy, breath work, and other components in there. And then there is this nonprofit arm that is the Good Medicine nonprofit that is engaging in community development and other components around that. So if folks were at the thank you dinner, that's where the Good Medicine hosted the Fungi Fest thank you dinner and pieces around that. something that's helpful with some of how good medicine as a community center, because we wanted to have a community center where people who had beneficial, scary, intense, ecstatic experiences with an expanded state, whether that's through ketamine or breath work or other pathways. We wanted people to drop into a community space where they could be a little more open. Whatever learning they had, they didn't have to go back into the closet, whether it's like the psychedelic closet. And so the Good Medicine Community Center was a place where you could show up and have conversations about whether it was a ketamine journey or some other journey that had happened. And through our own sort of mission development of this place where people who are working on their own inner self-transformation around community to implement change larger in society, we sort of came around these 4 practices, which is always a conversation. It's something that we hold, like, are these practices landing with me today? So one piece here is that we are all here for our own healing. Acknowledging that some of us come from high amounts of privilege or come from historical medical modalities where there's power structures around that. There is this acknowledgement that all of us are engaged in our own self-work. And we understand the professional obligations that we don't bring our work to our clients. We do our work off to the side, but we are not saying we are the experts. We are not saying we've figured it all out. And it's just an ongoing evolution for each one of us. We all practice our own sense of belonging. This one is a gesture or an effort to turn to folks. There's this acknowledgement that one common core wound that a lot of us can carry is that I don't belong. Mm-hmm. Whether that's I don't belong in this body, I don't belong in this community, I don't belong on this earth. And we feel like that's one of those pieces that if we could all engage in some sort of place where we're nourishing, I do belong here. Mm-hmm. And to put it in a spiritual lens, there was a reason why I was incarnated into this body and in this circumstance right now. So that's we all practice our own sense of belonging. We tend to fire this community together. And that's a effort to engage in some sort of sacred reciprocity in terms of whether it's cleaning the dishes, whether it's just tending to bringing beautiful flowers for the altar. There are all little ways that we can sort of engage and just put our efforts into the building of the community or the tending of the community. And then the last one is we believe that we are all doing the best that we can. And sometimes we have days where we're trying our best, but it might not seem the top performance in that piece. And it's just sort of this, like, every day is a new day, and we'll try to do our best, and knowing that best is not perfect, that best can be good enough sometimes. Yeah, thank you.
Is it me?
Yeah.
Okay. So ketamine is a really interesting molecule. I appreciated your intro for us, Hava. I feel that I resonate with that experience so strongly, having had a relationship with ketamine for 6 or so years now. I feel like I don't understand it necessarily more now than I did 6 years ago. Given that we're speaking in this context, I might compare it a little bit to psilocybin. Just top level, ketamine is a molecule that's first discovered in 1963, I think. Initially as on the search for an anesthetic that was an alternative to PCP, which was being used at the time because PCP was having such kind of strong, often negative subjective effects. Okay. And they alighted upon ketamine in that search, which really fit the bill. It's a very safe anesthetic. In response to someone's question about elevated cardiac effects or elevated heart rate, it's one of the real uses of ketamine, initially why it was developed and continues to be used in this way, is that it's an anesthetic. It really doesn't have a lot of the effects on the respiratory system and the central nervous system that some other anesthetics do that suppress vital functions, and so which makes it very safe. Furthermore, it doesn't tend to have, I think maybe ever, allergies in people. So one can give it in the pediatric emergency room, not knowing really much of anything about the patient, without much fear that there's going to be an adverse reaction, at least on a physiological level. It's an anesthetic that works in a different fashion than a lot of other anesthetics. It's classically called a dissociative anesthetic, which means it isn't necessarily kind of numbing in the way an opioid would or taking us away from the pain. It's actually creating space away while the pain will continue to exist or other experiences will continue to exist, but consciousness just starts to have a little bit of space from that. It with regards to its effect as a psychedelic, the psychedelics that most commonly people are familiar with, whether that's psilocybin, LSD, or something like mescaline, DMT, all work primarily on the serotonin system. It's often the serotonin 2A system. And ketamine works largely on an entirely different receptor system, which is the NMDA receptor system, the glutamate receptor system. And just to speak internally, as kind of someone who's interested in consciousness and subjective states, it's a real education on the nature, for me, of neurotransmitter systems to encounter psychedelic that works on a totally different receptor system. Because it was easy, at least for me, and I think this is often a common experience, to kind of start to relate when strong alterations of consciousness that we experience often are hitting the same receptor system. We can start to think like, oh, this is like the room that consciousness lives in, and these are the alterations that are possible. Ketamine reveals really quickly that there's whole other wings to that house of consciousness that we weren't maybe familiar with. We start to experience what is undeniably at higher doses a psychedelic, but a totally different type of psychedelic than something like psilocybin or LSD or DMT. It's used recreationally and medically through a number of different routes of administration. Most often recreationally out in the world, it's used intranasally or sometimes orally, increasingly orally. In a medical context, it's used through intravenous infusions, through intramuscular injection, which is one of the ways we use it in the clinic, which is just like a vaccine shot in the arm or the glute, or through sublingual, either a liquid or a lozenge. And increasingly in the ketamine world and the therapeutic world, people are using it in the form of these compounded lozenges. Another pretty significant difference between ketamine and other psychedelics, particularly when it's used through this infusion or an intramuscular injection, is both the speed of onset and the duration of effect. So ketamine, when used through an injection, it can come in very, very quickly, 30 seconds to a minute, 2 minutes. You start kind of on the top of a mountain, you come in at the height of the effects, and then the experience is kind of plateauing there for a while, and then a slow coming down from those effects. The acute effects of ketamine, depending on the person and the dose, typically last somewhere from like 15 minutes to an hour and a half, sometimes 2 hours for people. When we use it in the clinic, in most cases, because of that, we'll use a booster dose. So we'll have an initial dose and then a subsequent dose to kind of prolong the depth of the experience. So a journey in our clinic, a ketamine journey, is typically somewhere around 2 hours for like a 3-hour session, a bit of prep time, and then there's some time in the back end to land. And it also tends to clear the system fairly cleanly. So there's a little bit of wooziness, sometimes a little bit of disorientation, but within an hour or two, the system is pretty back to ground. And often, especially if the dose hasn't been really strong, you might not even really feel like you've taken anything. The anesthetic effects do tend to come a little more pronounced on the back end, so you can feel a little bit that like post-anesthesia feeling of wooziness, your vestibular sense, your balance might be a little bit off. Another, I think this is true for most psychedelics, but it's really pronounced for ketamine, is that there's a noticeable threshold of effect depending on dose. So at a lower dose, what someone mentioned, psycholytic and psychedelic, that's a term we might use in here just to clarify that psycholytic dosing of a psychedelic tends to be a lower dose where you're still quite functional, quite able to interact socially. And then a psychedelic level of dosing tends to be where you start to turn internally and aren't interacting in quite the same way. There's a lot of internal experience happening. And with ketamine, there tends to be these really distinct thresholds. And I'll just name some doses for those who are familiar with ketamine. Excuse if you're not familiar with ketamine, this won't mean anything to you. But speaking as like an oral sublingual dosing at somewhere around the 50 milligrams to 100, sometimes 150 for some people, that's in the psycholytic dose range. Where the initial effect will tend to be a downregulation of anxiety. People start to feel pretty relaxed, pretty open, really safe in their bodies. Maybe sometimes a little bit of floatiness starts, a slight alteration in sense of time and space, a sense of self, but the ability to interact, the ability to communicate, use language, think rationally tends to remain online. For some people, they might equate that a little bit with like a glass or two of wine, kind of just like a nice mellowing. Tends to be very useful for psychotherapy, interactional psychotherapy. We can process modalities such as IFS, which is something we use at times in the clinic, tend to function really well at this dosage range. And then moving up from that, there tends to be like a shift where attention starts to turn internally a little bit more. There tends to be a stronger alteration of space and time, alteration in sense of self. There's an effective ketamine that starts to come in more strongly here where there tends to be a lot of internal space. We start to be able to notice parts of ourselves with a lot of distance. This modality I mentioned, IFS, which works on the idea that we have a collection of kind of internal parts of ourselves, critical parts, kind parts, childish parts, and ketamine starts to allow us to be able to really experience these parts of ourselves with maybe greater clarity and greater awareness, greater compassion often. And then at higher doses, which is sublingually often or orally, often in the 300 milligrams, 400, 500 milligram range, the experience tends to become very, very internal. We tend to dissociate from the body. Often we have no sense of even having a body. It can shift to have really no sense of having a biographical self, no sense of our name, who we are, how we got there, no sense of being on a substance at all. And we have a deep immersion in our consciousness, often with very strong visual, auditory alterations, like a deep journey. And at Riverbird, we work in all those ranges depending on the person, the context, the type of work that we're doing. I've spoken a lot. Does anyone want to jump in? Yeah, totally.
I missed what receptor system you said ketamine works on.
Yeah, the NMDA receptor system. Yeah.
Yeah, quick question too.
Yeah, totally.
The chronic, so the like the LUTs, is that like kind of like the neurogenic bladder like issues?
Lower urinary tract.
Yeah. What are you? I guess that's one concern of mine. Like, do you have any insight in like how like common is that, or like what kind of dosing? You know, how frequently is that?
The published literature originally came from heavy recreational users in the UK, where the ketamine has been very popular in the recreational scene out there for a couple decades now. So they could look at sort of population studies of those folks, and it was pretty high amounts that was happening. I mean, grams.
Do you have any idea?
And so what we find is in our environments, it depends on how sensitive someone's bladder is. So if they're women who are prone to urinary tract infections, who just seem to like get them all the time and just have a sensitive bladder, sometimes they'll feel the irritation in the bladder, but it's a transient irritation, and there are ways to sort of, when you're doing a home dosing with sublingual, make sure you go to the bathroom before you go to bed so the ketamine isn't accumulating in your bladder. Because what happens is it seems to part of the irritation component around ketamine in the bladder is a formation of oxalate. So it's sort of, it has the oxalate crystals that irritate a little bit in the inside of the bladder. We rarely see it in the clinic. That's the only time anecdotally we see somebody saying like, oh, I feel like I have to go pee. Sometimes people, when they're in the ketamine session, say they're having an intramuscular session with us in house, the guided session, they'll just like, yeah, their bladder will be like, oh, I feel like I need to go pee. But that's very transient, and we haven't seen anybody. There's one client who's been with us getting weekly ketamine twice a week for years now, no development.
Okay.
Low doses, like
Yeah.
35 milligram injection with 300 milligrams at home, and that's been the routine for that particular. So,
Do you guys ever explore, with like compounding ketamine with anything in infusions? Like, so the nasal spray that I get is compounded with oxytocin. I'm just curious if you guys.
we haven't dabbled with that yet.
Okay.
There might be somebody in the audience who has, but
Like to.
yeah, and
Yeah,
just to
it's
speak to the
good.
tolerance and dependence piece, because there was around that. We'll talk a little bit more when we talk about relationship with the medicine as a way to deal with it. But yes, there is certainly in the recreational environments, ketamine, however people are showing up with what histories that they have, and if they're more prone to a substance use disorder, ketamine is like it. For me, it makes sense that it is regulated to some component because you can build a tolerance to it if you ramp your doses quickly. But for example, this client that we've been seeing for years who's just been doing the same dosing, low dosing. So we don't see tolerance develop in low dosing, and then that spectrum of tolerance turning into dependence. We haven't seen that, though the way that we typically practice that sort of long-term client patients is exception. We usually like to think of our dosing as you're coming in for an intervention, you're coming in for some period of treatments, and then hopefully people will end, or if they don't, they just transition to a maintenance, and then the game is how far to stretch out that maintenance. Is it just in the transition seasons of fall and spring when things are hard that they come in for a treatment? Is it more like every 6 weeks? So there is a piece that we notice, and that's really for people who have like diagnoses. In the psychospiritual growth cohort, to put it in that term, sometimes it's just I want to do this once every couple of years because they're using that much more as a journey and sort of an investigation into something new.
A couple of questions. Is ketamine used as an entry point for psilocybin since it's a heart opener, just like MDMA is often, it can be given in the beginning in order to do the heart opening relaxation, low anxiety to be able to go deeper in the journey? Or is it mostly just used like on its own? I'm curious if there's any
Never
combination.
heard of it being
I have.
used. Ketamine as a.
Yeah, we can, and certain people in the underground who work with psilocybin or some of the other substances will use ketamine either in the evening before or the day of, and it'll be a fairly low dose lozenge, and for that very purpose of kind of opening the field before you go into a deeper dive with an opening.
Okay, and on the high dosing, you talked about how there can be like this no sense of body, no name, who you are, how you got there. Do you find that clients experience a lot of fear and terror as they enter the space of great dissociation from who they are? Or does the medicine come in such a way that the lowered anxiety relaxation kind of nullifies that terror and fear?
It tends to lean more that way. It's certainly not. It happens that someone can encounter a lot of fear as they enter a real dissolving, a highly. I don't like the term, but it's used in ketamine, a highly dissociative state, like a deeply dissociated state. But it tends to happen more that quality of anxiolytic, the downregulation of fear tends to allow the individual, allow the psyche to let go and just open into that disillusion in a way that's really remarkable. I think it's one of the.
How kind.
It's incredibly kind. Yeah, I think it's one of the real benefits of ketamine. Ketamine is a. I think that the initial response we most often get is someone coming back from first experience and saying, "That's incredibly weird." Beautiful, but it's a very weird substance. The experience is very, very strange. But one of the beautiful things about ketamine is, as strange as it can be a wonderful initial medicine, initial psychedelic, because of how kind it is in that way. It allows us to let go. I think of it really as a medicine teaching, more than anything else, teaching us to let go. It just allows us to open and let go to impossible strangeness, just really bizarre experiences of consciousness, without a fear response that we might anticipate, and that so often is the case on another psychedelic. Where as we move into that fear, there's the psyche has a reaction to it, but that cuts both ways. So I think the lack of fear can also mean that some of the growth that comes from that deep letting go on another psychedelic, where we have to pass through the threshold of fear, doesn't necessarily happen with ketamine.
Yeah.
And there's growth to that. It's an important part of the process of letting go when we have to walk through the doorway of fear. And ketamine, it can take us right around that, and it's wonderful. And then it might leave a lot of that fear still online for us to resolve through other means.
Yeah, I was just wondering because ketamine doesn't last very long, whereas like psilocybin lasts like 5 to 6 hours, and then there's other stuff that lasts longer. So if you had a lot of anxiety, and maybe one of what you wanted to work on was anxiety, and then you're anxious about the experience, and I read also that having too much anxiety holds you back, the setting in your mind and stuff. Would this be a good way to kind of break into another level because it doesn't last that long? You can have the experience and realize it's not that scary, and then kind of be more open to that would be like
Absolutely, yeah. I think it's a
pathway.
wonderful use of ketamine as a way to start to be a doorway into more expanded states and into
We all-
those experiences.
We also find we we have more than a handful of patient clients now who come to us on SSRIs often, so like Prozac or other ones, who we actually taper off of their SSRIs through the ketamine. And so then often they can't seek other forms of healing, whether it's psilocybin, MDMA, or others, because they're on medicines that are contraindicated. So I want to do a job of better tracking this more than a handful of folks who've come through, but we've been successful at tapering people off of SSRIs so that they're familiar with an expanded state of consciousness with the ketamine. They're now off of their SSRIs, and if they want to do work in a different receptor system, say with psilocybin, they could go into that with less worry about contraindications of their prescribed psych meds. But that's not something we can do guaranteed. That's case by case. But it's been really sweet to see just that transition, because there are some people where tapering off of their SSRIs might not be a good idea, but sometimes that's actually a goal that they want, and we can help them sometimes.
And is that
I just noticed the time.
We
and I
should
think
keep rolling.
we should keep rolling.
Yeah.
quickly on that though? Are you using the ketamine for the decrease, or having them decrease the SSRIs prior to use of the ketamine? During, yeah.
Yeah,
Yeah, quick note on that. Just it's one of the real benefits. Unlike many other psychedelics, there's very few counterindications with regards to pre-existing medications. So something like an SSRI antidepressant, you can begin ketamine treatment while taking it.
Next one.
Okay, so ketamine assisted therapy is using ketamine, as we've been talking about it, but pairing it with someone who operates as a guide and as a support. And specifically, we will go in and work specifically on psychological issues as they emerge in the course of the treatment experience. So a lot of the psychotherapy can happen in preparation for the experience. Sometimes, if it's a lower dose, you'll actually do a therapeutic process while under the influence of the medicine. If it's a higher dose, usually you're not interacting and you often can't talk. So you'll have the experience, and then there's another round of the more therapeutic aspect in the follow-up integration. Or well, sometimes on the tail as you're coming out, there'll be some working with the therapist in the room, and other times not so much. They'll keep it quiet, and then in the integration of the following day, there'll be more of a therapeutic experience.
So safety is something we want to hold paramount in our clinic and something we think a lot about in psychedelics in general. And so contraindications medically, if someone had uncontrolled hypertension, say their BP was super high, we would want them to get it controlled. If someone had unstable cardiac conditions, if they had an unstable hyperthyroid condition, if they had a really significant of interstitial cystitis, bladder irritation, we'd want to talk about it a lot. If they were pregnant, we wouldn't treat someone who was pregnant. There could be some uses for ketamine in pregnancy, depending on weighing the benefits versus the risks and couching all those things. If someone had a severe renal or liver disease, psychologically, if somebody had a history or any kind of active psychosis, we wouldn't treat them. If someone had a history of psychosis, say for bipolar disorder, and it had been remitted for a while, but say they were in a really significant depression, then we would consider treating them, and we have treated, I think, 1 or 2 people like that with good results. If someone had a significant dissociative disorder, like dissociative identity disorder, it'd be really likely that we would treat them, just because broadly speaking, well, one, that the road is quite long, so you're going to want to commit to that and make sure you can commit to that. You're going to want to make sure you have a lot of support as well in it. So just trying to be really transparent about those things. And there are going to be a lot of bumps in the road, which are totally understandable with something like that. We just need to be weighing all those things. If somebody was in a manic phase of bipolar disorder, it would be contraindicated. If someone had a really significant poor social situation, say they were at home and in some kind of abusive situation, or didn't have stable housing, or didn't have a stable job, in ketamine, to some degree, we expect some degree of destabilization, which in some ways we view as a good thing, actually, because certain things are opening up that otherwise might not open up. And so we just want to have someone in a place where one, we're totally transparent about that when we talk to them, but also, two, that there's a place that can be held, both by us, but also at home. And if someone had a substance use disorder, which we could probably talk about for hours. So if someone had an active substance use disorder, we wouldn't treat them. We'd want them to get that in a better place. But we've definitely treated people who have had a history of substance use disorder, most specifically alcohol use disorder. And there's actually some really good research around treating people with alcohol use disorder, specifically with ketamine. And look forward to more of that research coming. So we're going to try and leave time for questions at the end too, to see you guys know.
Try to get there.
Thanks for all of your lovely questions so far.
So just very briefly, individual ketamine assisted therapy is literally one person with 1 or 2 guides. I'll leave it at that.
This is how we started.
Yeah.
We started in this model with the 2 guides or 2 therapists and 1 client, which is the thing you hear in the research studies and components around that. And so that was us getting comfortable with our skill sets, learning from each other, and getting our chops or skills pulled up.
In case you're wondering anything about HIPAA, this is all set up. This is our clinic coordinator, Maddie.
This is not real.
It looks just like that though in the real world.
So we transitioned to group ketamine assisted therapy because of cost. To have 2 professionals sit over, do preparation, to sit with somebody and to do integration afterwards, it's a lot of money. But ketamine is actually really not that expensive of a medicine. It's the service that costs a lot of money. Mm-hmm. And we were, in one of our ongoing inquiries around accessibility, we took the group medical visit model, which is a way of having a group of people sit together and have a ketamine experience together. And because many of us come from group ceremony experiences in different environments, it also allowed us to transition from the individual therapy, which really could be tailored to how that individual is showing up. We could be secular if they're not in a place where they want to talk about spirituality or the divine or anything like that. And what transitioned for us by piecing together this group model where we also came together and sort of like we had our different experiences, like what creates a ceremonial container, even though we're a medical clinic. So this lowered the cost for us. This also created the group effect. So when people, and this is used, and that's in group medical visits, they use this a lot about having a group of veterans who all have hypertension together, come together and just like talk to each other, and they can talk about like the best salt replacements. So there's a lot of peer-based learning that can happen in the group environments. And so we started offering group ketamine therapy. And we've done it for people, say, who they all have treatment-resistant depression, or we've done it for healthcare provider, not healthcare, like healing professionals. We've done it for business, people who are involved in business. So we just sort of have evolved our comfort in terms around that. And I think Colin's going to talk a little more about the ceremonial.
This one could come through.
Okay. Oh, that's okay. Basically, a sidebar is that the length of action of ketamine is shorter than psilocybin or LSD. And so the working window of ketamine, there's somebody might just be getting into a process where they're understanding a little more about their inner personality structure, and then the medicine wears off. And so we found that actually offering ketamine multiple times is a way to help evolve that psychological awareness and exploration and hopefully changes around that. This also lined up with the published research that just used ketamine for infusions, for depression, finding that like multiple experiences of ketamine kind of close together had just the improvement in depression symptoms. So for our group ketamine, we have people come in for say it's for people who are just working on their mental health promotion. We'll have them come in 3 times for a group ketamine experience. And then on the in-between weeks, depending on the individual, they might be doing home program, which is taking that lozenge, taking the sublingual in between. For the Healing for Healers program that we do, we've had it spread apart, but now we're condensing it together, where a group of healing professionals will come in for 2 ketamine ceremonies right next to each other. And we're focusing on the ceremony, but there's certainly something to be said about preparation and integration afterwards. Yeah, let's just go into the next time-wise.
Yeah, so Selma said we kind of moved to group work for because of the cost, and that was certainly a consideration. But I think really we were a group of practitioners that founded Riverbird and Good Medicine, coming from our own group ceremonial healing experiences, and had tasted the power of that. And so I think, at least for me, and I really think for us, one of the deep intentions behind Riverbird is the reintroduction, the deepening of the use of ceremony within a medical context, and really starting to kind of work that through together as practitioners and as a culture. So it's something we feel really passionately and deeply about. And there's a lot we could say about ceremony, and I don't think ceremony is one thing. But I'll just say a few words. The way I think about ceremony is this is an age-old human technology and understanding of how to work with deeper layers of the psyche, layers that are maybe non-rational, to speak really kind of broadly, like what we think of as like more right brain processes in the psyche. It responds to this language of ritual and ceremony. So there's many components that could go into a ceremonial context or a ceremonial container, but these are a few of the ones that we emphasize and really practice in our ceremonial medicine at Riverbird. One is a real attention to the space, the physical ceremonial container and the psychic ceremonial container in the space. So it involves clearing it physically, cleaning it, clearing it kind of psychically through things like smudging it with sage or sound or music bowls or different ways to kind of clear the space energetically, calling in the 4 directions, having kind of a psychic and physical geography of the space, which has a perimeter and also has a center, a psychic center of the space as an altar. So it's something we have in our ceremony, in all of our treatment rooms and our group ceremonies. We build an altar that often has flowers, has candles, has objects of significance to us as facilitators and us as a clinic, and then we invite participants to bring in objects of significance that often relate to their intention or relate to supports that they hold in the world. And we all kind of collect these on the altar to have like a psychic gathering point, a psychic orienting point for the ceremony. In the way we hold ceremony, there's kind of a trifold nature to ceremony, kind of in a similar way that there often is to psychedelic therapy, where there's a preparatory phase, a journey phase, and an integration phase. In ceremony, we think of it having a beginning, a middle, and an end. And along with that, kind of an opening ceremony, an opening ritual. Often at Riverbird, this includes song, a poem, some sort of dropping into space, a speaking of name. And then the heart of the ceremony, which is often the journey, the ingesting of the medicine. And then again, a closing ritual, often again, a song or something like that to then close the space. So there's kind of like both a linear chronological container for the ceremony and also kind of a psychic boundaries for the ceremony. Again, these are all ways that we think of how to work with the psyche, particularly as it enters into very sensitive, very vulnerable states. There's
Let's do the last one.
And relationship is a key piece, both within the group and the individual context. So we really emphasize relationship to the medicine, the individual's relationship to the medicine, a relationship to each other in the healing phase, relationship to the facilitators, just drawing attention again and again to how we are with these forces and people and beings.
I think that's to go back to that concern of substance use disorder or the tolerance of dependence. There's an invitation that we offer to folks, and instead of having a transactional or sort of an extractional relationship with this pharmaceutical is going to change something within me, is actually to think of, so it's easier to do in environments, say working with psilocybin or the more natural-based psychedelics, to say that there's an essence to that medicine. And if that essence is another being, how do we have a relationship with that other being, and how relationships take work and relationships take a respectful engagement back and forth. We can do the same with the ketamine. And that's sort of one of our psychospiritual harm reduction techniques. Is just if we can think of the ketamine as an entity, as something that has its own intelligence or something that is trying to help us, how would we engage with a human being who's like that? How would we engage with another animal like that? And that's just something that it's can be a really big phase shift for people. So it's just an invitation, but something just to brew in your minds, but something that we welcome over and over.
Just briefly, oftentimes in between sessions, we offer an at-home ketamine program where you get a certain dosage of a lozenge, usually between 50 and 200, although it can go higher depending on what your needs are. And you take that lozenge on your own at home. So we invite people, we teach people about creating their own ceremonial and sacred space at home, make sure that they're in a safe environment, and then you can do your own ketamine experience at home on your own. And it's a way that people really develop a relationship with the medicine, what Selma was just talking about, because it's just you and the medicine. And so we find that it really does facilitate that. It also encourages people to develop a sacred and ceremonial space and to be thinking about their healing and working with the medicine in that way. But it also, medically does help people continue with the work and keep some of the issues alive and ongoing if there's another experience with the ketamine in between the higher dose sessions. We also use an at-home program. Sometimes at the end of treatment, people will go either for a period of time or sometimes over a long period of time with an at-home program. And that's tailored to whatever people's needs are.
So we have a referral process as well. If you have any clients or patients you want to refer, please do. We definitely do not expect you to know who might be appropriate entirely or who might not entirely be appropriate. So if you have questions around that, please reach out. Just so you know, people can also self-refer as well. So, and if you go onto our website right there at the bottom, riverbird clinic.com, And I know it's 10 on the nose right now. People want to say it, can't say it where I can. I'm not sure if you guys can as well, but we're happy to say. And our clinic coordinator email address is right there, info@riverbird.clinic.com. Please reach out if you can help at all.
A final thought before people head out. A few years ago, ketamine was thought to be not existing in the natural world, to something that had come up from dreamed up from the ingenuity of humans, and it was discovered 4 or 5 years ago, being produced by a mushroom. So it is very well placed here at Fungi.
Thank you all for coming out today. Happy to hear
Do we have to give up this room?
No.
Okay. We'll wait till we get kicked out. If people have questions, they're welcome.
Next talk is 10:30, so if anyone has questions, feel free.
They mentioned, kind of starting with this kind of medical model, that do not offer aesthetic, the Spravato.
We do not.
Is there a reason, like, is it to not use that product?
Yeah, ketamine is an incredibly cheap off-label generic medication. It costs effectively nothing,
Okay.
like $1 a dose.
Okay.
And as ketamine was largely developed, I mean, this is my bias here, but to make money for pharmaceutical companies, so they'll charge $500 a dose for a medicine that really is generically available. So
And
that's part of the reason.
And you don't have as much flexibility or adaptability
Right.
when doing Spravato.
okay,
Using ketamine allows us to use a lot more creativity.
Yep.
In terms of what's going on.
you speak about trials. Are there some like kind of landmark trials that have determined treatment models or?
For ketamine infusions, sure, but for the ketamine assisted therapy piece, that's still in development. There's some folks, they don't talk so much, there's like more like a cohort following that happens through the Ketamine Research Institute, where they looked at ketamine therapy clinics, but they're just looking at outcomes. They're not sort of talking about the mechanism within it. And so that came out, I think, in 2018-19. And it was following through those, aggregating the data of 3 clinics on the West Coast.
Okay.
And looking at and those were the first publishing on ketamine assisted therapy as opposed to ketamine infusions.
We're also fortunate enough to have Selma too gathering data for us. So Selma teaches at UNE, and so at some point I'm sure that will become available perhaps.
Landmark study is coming.
Yes. Yeah.
I just had a question on so I've heard a little bit of conflicting. So we use it in the hospital a lot too for like seizure suppression, but I've heard that there is some stimulation of the excitatory neurons of the NDMA with NDMA receptors, and that seizures are a potential a side effect in certain doses. Is that do you have any insight? Is that true or not? It's weird using it in the hospital for seizures, but then I've also read that there is some stimulation.
Do you know what the dose is?
I think anything's possible, but incredibly uncommon.
Yeah.
In all of our years of operating, we have yet to see a seizure. And my guess is there's probably some kind of threshold there, where if maybe you're reaching it, then it's possible, but not in the doses that we're using, not that I'm aware of anyway.
Do you mean stimulation of seizures or stimulation of heart rate?
Excitatory neurons,
Okay.
neurons. Yeah, I know it's an antagonist and an antagonist, but I've heard that it actually antagonizes and suppresses the inhibitory neurons, but can excite the excitatory neurons.
Your question was on seizures.
A rhythmic way that could potentially break the seizure threshold for somebody.
It's atypical. It can cause stimulation, but rarely.
Yeah.
Usually after a journey, a person feels tired, fatigued.
Yeah.
Usually people sleep really well, but people can sleep poorly or feel more awake after. But it's less common.
It does increase heart rate, blood pressure.
Yeah.
Thanks.
I wonder if that's dose dependent too.
Yeah, and it was just one study that I was looking at, and the majority of the pharmacists that I've talked to in our hospital, everybody is yes, and we use it in massive doses.
That's what I'm
for
yeah,
ketamine
that's-
suppression,
yeah.
for seizure suppression. It's cool, insane how much ketamine we.
And I think that's a piece of context is useful to have in mind when thinking about the psychedelic use of ketamine is the common doses in the hospital, like you're speaking to for anesthetic, are way higher than what we
3,000 milligrams.
Yeah, like we use like 15 milligrams per kilogram.
We rarely go above 2.0,
Yeah.
so.
Did you have a question?
Yeah, I just wanted to offer that I've been personally through 3 of the group sessions with Riverbird and found them to be skillfully and lovingly administered. It was a very positive experience in my life. Just wanted to share that and thank you all.
Dustin's been a great ally to us as well, so.
How did you?
Yeah. Of course, in like shamanic traditions, music is an incredibly important component of ceremony space. And I'm just curious the way in which you all use music or any research related to music or anecdotal information about how patients interact with music on a ketamine journey.
We skipped over that bullet on the slide, but yeah, there's the classic psychedelic therapy model and some of the Hopkins studies, stuff like that. It's just to have a canned playlist and to have and we, in our efforts to make it more ceremonial and this idea of this engagement of consumption versus production in terms of like arts and component like that, something that for those of us who are comfortable with it, we'll start singing. So we just, and we'll just, it's like, it's really just like a little seed of us using the creation of music with our own bodies, just to introduce that idea. And then we do use playlists afterwards. And there is an arc of like what style of music at what time throughout the medicine journey experience. Some of us use canned playlists. Some are skilled enough to mix on the fly, and in our group's growing experience, sometimes we've paused the playlist and gone back to song, and sung live or used singing bowls in the moment, and then go back to the playlist. And then in the closing, depending on our comfort level, we'll close with a song or a poem, depending on how the facilitators want to roll. But yeah, music is essential. And interestingly, some of our trainers, Kathy and Florian Berkmeyer, who do ketamine, they do it in silence. Because there's also this engagement of that self-work of how much of my own agenda am I putting on by choosing the song or making this playlist and wanting it to go a certain way. And like, so that it is an interesting game of, okay, can you choose a song that isn't driving the bus too much, but creates a sonic container that allows people to go wherever they want? And there are some qualitative components around like polyrhythms or like, and just using less predictable beats. Because actually there's sort of ways of like choosing tracks that could align more with the ketamine consciousness.
I think it's a really interesting question, the question of music in psychedelics and how much that steers the journey. Yeah. And now in my work at lower doses, increasingly I don't use music just because of that, because it's so supportive and it also is such a strong influence. And I think it's probably an even stronger influence with ketamine than maybe other medicines, in my experience.
I know we've had clients on at-home programs that have used like white noise and brown noise and other types of like, so they're still listening to something, but I've heard people say that is a very different experience rather than using music because the music can kind of guide people to other places. Yeah.
Which can also really be an asset for some people who are a little bit anxious going in or who are a little more scattered. It actually helps them focus. And also sometimes when people get lost in certain places and they start to kind of, you can offer the instruction that they allow themselves to be either supported by or guided by the music. And what happens is it helps them kind of gather themselves and kind of get back to whatever it is that their agenda is. And so the music is used as a support and it can be very effective.
With just one thought on music, there's differences someone was speaking to, and I think with ketamine, melody tends to be a little bit less important and rhythm and texture tends to be more pronounced. So it's something we think about when we
Your presentation is really superb and very impressive, and you communicate thoughtfulness and caring, just as Dustin said a minute ago from his personal experience. My question is, are you having some influence, positive or whatever, on the community, larger community, on perhaps doctors, therapists, whatever? Do you find that because you are so thoughtful and caring and you know, the way you present this and the way you're presumably carrying on your work, is that having educational and, you know, benefits in the larger community that you can see. I know it's so confusing now as this explodes and you get so many people doing it on their own and so forth, but.
Well, thank you for that reflection,
Yeah.
for starters. And I would say yes, in that, in two ways, I think. In the Heal for Healers program, we've invited other healers in lots of walks of life to come in and experience the ketamine and also experience how we do healing, basically. And so I think we've had a pretty big influence in the community in terms of supporting other therapists, doctors, practitioners to open up their scope of how they think about healing as a result of the experience that they've gotten themselves. And then we've started a small training program of other therapists who are wanting to use ketamine in their practices at some of the smaller doses with the lozenges. And so we're starting to have a cohort of people in the expanded community, as far away as New Hampshire and Maine, who are learning from us about how we do the ceremonial aspects of the ketamine and how to work with it in their treatments. So we're beginning, and
Yeah.
that's part of our mission, or that's part of how we've been envisioning our work, especially once we got more comfortable actually doing the work, is to try to have an influence or be a support to the community and bring it out to a wider circle.
Yeah, I'm wondering, you talked about the music interaction. I'm wondering if you also looked, especially given you mentioned this breathwork done at your center, if you looked at integration with breathwork or preparation.
Both. As integration and preparation, people can engage with breathwork. Sometimes people who've seen the breath practitioner then hear about us and come for a ketamine experience. But simultaneously, we suggest that breathwork is an integration afterwards. We haven't combined them together in, say, like an experience itself, unless there's been some side project.
It's a discussion right now.
Yeah, there's some creative ideas that sometimes they like have little sprouts, and then so breathwork, it's such a beautiful pairing. It's because there is this piece, like there's an idea of like, can we be more conscious of actually having people do breathwork preparation before going into the medicine experience, so that they can have an engagement where they don't feel like they got on the ketamine train and that train is going to go, where they have a little more agency in the breathwork, where they can sort of go in and go out of wherever that state they're going.
Maybe we can take one more, and then maybe we should close, just in case someone has to come in for a 10:30 talk. Oh, please, no, please go
Well,
ahead.
yeah, I was just gonna, my specialty as a therapist before I retired was in somatically based trauma therapy. I was a somatic experiencing practitioner. And so with the dissociative aspect of ketamine, which I've never used personally, so I don't know, how that is, the physiological part of trauma work in my world was key in the healing aspect, and just wondering how that tracks with the ketamine work.
And were you going to jump in and say something, Dave?
I was just going to say that I think what I've seen is when people have dissociation, it's really interesting that this medicine, I think, can bring them back into reassociation. That this medicine can bring, say, dissociated people or people who have dissociation back into reassociation, depending on a lot of different factors. And I think people can have really embodied experiences, actually, where somatically they can feel a lot on ketamine. It's not across the board in that kind of way. But just wanted to add those things. And Colin actually does a practice that focuses on somatic therapy. So
yeah. I mean, just piggybacking off what David said, I totally agree. I think there's a lot to say on the relationship between dissociation and ketamine, but a couple thoughts. I think there's a lot of different types of dissociation, and traumatic dissociation is very different than the type of dissociation that ketamine engenders. And they can, like David's suggesting, they can actually play together in a really interesting way, where the dissociation of ketamine can actually reduce the need for traumatic dissociation and allow association to the body. Can start to, the distance from the body can actually create a really effective working distance from somatic felt experience to allow reassociation to start to happen.
But
Again.
thank you, I get that.
Yeah, a lot to be said about that. I think it's a really important discussion with regards to ketamine.
Yeah, thank you.
Thank you all so much for.
Thank you.
Reach out, we can help it out, if you have more questions.
Very good.